Mr. Moore, you're recognized.
Thank you, Mr. Chairman. Ms. Graybert, the University of Utah in my district has provided data that indicate that of the patients that require specialized post-acute care, the majority require either home health care or skilled nursing facilities. MedPAC has long indicated that there is sufficient access to home health care, but many people are saying that access measure is flawed. Could you shed some light on this? Should MedPAC adopt a new measure of access? If so, what elements should this measure incorporate?
Thank you for the question, Mr. Moore. No, I don't think MedPAC's measure of access for home health is flawed. I support MedPAC's methodology.
Is there any ways to, as we look at the approach to this, any ways that you would suggest we improve this?
Certainly, I think access to care issues are always something in the Medicare program that we need to pay attention to. I don't have a specific recommendation for you today, but I'm happy to follow up with your staff after
Excellent.
Today's hearing.
Thank you. And like my colleague, I represent several rural counties, Mr. Fleece, particularly in northern Utah. In many cases, telehealth is the best option for Medicare patients. How does Empath Health employ telehealth services to improve quality? What are some of the best practices that may be employed elsewhere? This is obviously a big topic that we're going through here in Congress, and we've had multiple times where this is going to expire, and we've done it temporarily. Like, share a little bit about how you would approach this.
Thank you very much, Congressman Moore. And Empath Health prides itself at serving the rural communities across Florida. Telemedicine is a critical part of ensuring access to care, whether it's recertification of hospice eligibility or ensuring that in crisis that we can get access from communications perspective to all of our patients. It's also mission critical to our home-based care organizations, those that are suffering chronic disease or post-acute, to ensure that home-based care is there for the rural communities through telemedicine to reduce hospitalizations, readmissions that home-based care has been proven to demonstrate. And we are also always looking for additional infrastructure investment to ensure that not only do we have telemedicine from a policy perspective, but we are able to connect to the rural communities, whether that be through satellites or other technology that Empath invests. It's not just policy, it's also infrastructure from a technology perspective that is mission critical to reach the rural communities. Excellent,
thank you. Lastly, Dr. Don Gilly. Post-acute care facilities nationwide were operating at approximately 85% capacity back in, say, 2019, obviously before COVID-19 exacerbated much of those resources. Can you shed some light on current post-acute care capacity? Does our current post-acute care infrastructure have enough beds for patients in need?
I think that for the most part, beds are available. Why we're seeing shrinking access is not so much the bed availability, it's the inadequate payment or the restrictive criteria that are used in order to allow those patients to access. And I'll cite the Medicare Advantage challenges as a prime example of that fact.
Excellent. Thank you. Appreciate that. I yield back.